Hello, my colleagues. This is continuation of what I was mentioning. This is part two. I was talking about common drug-drug interactions which should not happen and which we should be aware of them in clinical practice, and we should not give them together. I mentioned the digoxin and verapamil is wrong. Digoxin and amiodarone is wrong. Digoxin with quinidine is wrong. We should be careful when giving them together. Also, combining the potassium sparing agents with potassium supplements or drugs which might produce hyperkalemia, like ACE inhibitors like captopril or enalapril. So we should be careful because both can cause hyperkalemia, which is dangerous to the patient. So combining these, that's a potassium sparing diuretics with ACE inhibitors is wrong, especially if we give the patient potassium supplements. This might also produce dangerous hyperkalemia, which should be avoided and which should not happen. Also, combining warfarin, and warfarin is an oral, one of the traditional oral anticoagulants. We should not combine it with quinolones, or warfarin with macrolides, also dangerous, or warfarin when given with some antibiotics like warfarin with rifampicin, also dangerous to combine these two together. And also, as I mentioned, SSRIs, combining them with other drugs acting on serotonin like trazodone or like tramadol, or like some other neuroleptic medications, because side effects will be higher. Also combining sildenafil, which is a drug used in erectile dysfunction, with nitrate medications like isorbid mononitrate or dinitrate. It is dangerous also. Combining the blood thinners like antiplatelets and anticoagulants with non-steroidal anti-inflammatory drugs also is wrong. Combining warfarin with non-steroidal anti-inflammatory drugs is also wrong. These are common examples of drug-drug interactions which are dangerous and which might threaten the life, and we should not combine them together, and we should be careful about that. Also, other examples, combining some of the lipid-lowering drugs like statins with some of the antifungal medications and the fibrates also is wrong. Combining two statins, as I mentioned, because they belong to the same group, is wrong. Combining two fibrates also is wrong because they are belonging to the same group of lipid-lowering drugs. But combining statin with fibrate is okay, no problem. So be careful about such common examples of drug interactions, especially the examples of drug-drug interactions which I mentioned and which should be avoided in clinical practice. What are the mechanisms of drug interactions? Actually, the drug interactions or the drug-drug interactions might be due to interference together at the level of what we call the bioavailability, or maybe due to interferences with the pharmacodynamics, that is the movement of the drug after its ingestion or its introduction into the body, whether by the oral route or by parenteral route. Its movement inside the body, especially interference with its digestion or with its absorption when taken orally. Interferences also with its metabolism in the liver or in the kidney. After that, this will affect its pharmacodynamics. Through effects on the liver, through effects on the kidney, which are the two main organs in which most of the drugs are metabolized. Especially, we should notice the effects of drugs drugs which act on the cytochrome A450, which is a common cytochrome enzyme in the liver, which is related to drug metabolism. And we have foods which stimulate it and foods which inhibit this enzyme, and through this mechanism they might produce some sort of dangerous drug interactions due to interferences at the level of the drug metabolism in the liver. Also the same at the level of the kidney, we should be careful. Or the drug interactions may be due to disturbances in the bioavailability and the plasma protein binding. They increase the free concentration of the drug by displacement of the drug from the plasma protein binding sites. So through the effects on plasma proteins and the binding of the drugs in the plasma, they might also produce interactions. Also interactions might be at the level of what we call the pharmacokinetics, that is the action of drugs on their target tissues or organs or receptors. So the interactions might be at the bioavailability level, at the pharmacodynamic level, or at the pharmacokinetic levels. This is the mechanisms of drug interactions. It might happen at any of these levels and produce such dangerous results and effects, and increasing toxicity or increasing side effects, or nullifying the clinical effects of any of the included medications in the combination. So this is the mechanisms of drug interactions or drug-drug interactions. The same mechanisms can happen with the food, the drug-food interactions or drug beverage, but this most probably and most commonly happen at the level of the gut due to interference with the digestion or absorption of the drug by increasing its digestion, so increasing its bioavailability, or by decreasing its digestion and absorption, so decreasing its bioavailability and needing to increase the dose of the drug in order to achieve its clinical effects, or in the first case to decrease the dose of the drug in order to decrease its side effects and toxicity when the drug is taken with that food or that beverage. So this is the mechanism of drug-drug interactions and drug beverage or food interactions. What are the, then I come to an important issue, which is what are the groups of people who are at risk of drug interactions. Drug actions usually taken when 3 or more drugs are taken together, as I mentioned before. When 3 or more drugs are prescribed together, here the incidence of drug interactions will be, drug-drug interactions will be high. And this is usually happening in elderly patients or patients with multiple pathology. And the elderly, especially the elderly, suffer from multiple diseases and multiple pathology. For example, he is diabetic, hypertensive, and hyperlipidemic. So given medications for diabetes and for hypertension and for lipids, and maybe also given medications for some other complications on the heart or on the blood pressure or on the kidney. So he is sure taking in his prescription and prescribed by the doctor 3 or more medications. This will put him or her at risk of drug-drug interactions and serious problems, which might increase the morbidity and mortality of that individual. Elderly people are at risk because they are usually taking multiple medications, because they are usually suffering from multiple diseases, so they are liable to many problems, especially to postural hypotension and especially to sphincteric problems and falls and fractures. So be careful, because they such drug interactions might put such elderly people at risk of health hazards. So this is a special group of people who are at risk for drug-drug interactions. Also, pregnant is special group vulnerable to interactions. Children are also vulnerable to drug interactions. Patients who are immunodeficient are vulnerable to drug interactions. Patients with chronic medical diseases and organ failure they are also liable to drug-drug interactions. Patients with other specific medical conditions in which some drugs are contraindicated are also liable. As I mentioned, G6PD deficiency, which is hemolytic anemia, they should not be given some medications, and it is dangerous to give them some medications, so we should observe such things. So they are among the special groups, vulnerable and at